A very beautiful morning to every one of you. How are we all doing? I know we're doing exceptionally all right. In today's video, I will be teaching you oxygen therapy. Lots of students have issues with oxygen therapy in their OSCE exam, but I keep saying this, OSCE is simple and nurses are brilliant. So guys, I'll teach you everything you need to know about oxygen therapy. And after today's video, trust me, if you have oxygen therapy in your OSCE exam, it's going to be a big pass. Without wasting any of your time, let's get to it.
Ryan Little.
Welcome to my channel. I'm super excited to have you here. If you were seeing my face for the very first time, my name is Violet Okolocha, and on this channel I share every tips to make you pass your OSCE exam in one sitting. You could register for our online classes if you want. All our students are doing exceptionally okay and they are all passing their OSCE exam in one attempt. Now, before we dive directly into this video, I want to give a shout out to those of our students who smashed their OSCE exam just yesterday. Shout out to Clinton, and this is what he has to say. Thank you so much, Nurse Violet. It was such a blessing learning from you and mentoring me when I needed it the most. I'm happy to inform you that I've successfully passed my OSCE exam. God bless you richly, and I want to recommend anyone ready to sit their OSCE to look no other place than registering with Nurse Violet. I remember when I emailed her at dawn on my exams, she quickly responded to me, and I asked myself, does she not sleep at all? Oh my God, I have a passion to make every student writing their OSCE exam to pass in one attempt. And this is from Nurse E former Nurse V. I passed my OSCE. Oh my God will bless you. I owe you a lot. You are a lifesaver. Congratulations, E former. And this is from Sister Nosa Detitu. He said, Mama, I passed. To God bless you for me. So these are those who passed yesterday. I like to appreciate those who passed also day before yesterday. I don't want this video to be too long. Now back to oxygen therapy. Your assessor has said to you, you are going to be doing oxygen therapy. The time allocated to the station is 8 minutes. Do you have any question? And then you say no. And then she says, your time starts now. Guys, first thing first, check for scene safety, except your assessor says assume all checks have been done. So if your assessor does not say to you, Violet, assume all checks have been done, first thing first, I check for scene safety, I provide privacy for my patients. You are not drawing any curtains to provide privacy. We just verbalize this. I check for scene safety, I provide privacy for my patients, and then I do my hand hygiene according to World Health Organization. I always recommend my students use the hand sanitizer instead of water. The only reason is because water takes a lot of time, but the hand sanitizer is quicker. Do you understand? So using hand sanitizer and water is good, but I prefer hand sanitizer only because of the time it takes. So do your hand hygiene according to World Health Organization. Palm to palm, back of hands, fingers interlaced, fingers interlocked, fingers interlocked, rotation of the thumb, tips to the finger, and the wrist. My hands are clean. Now you go straight to your patients, picking up your chart. I'll be sharing a similar chart. Take note of this chart. It's important you understand this chart, okay? And then you go straight to your patient. Hello, my name is Violet. I'm one of the registered nurses looking after you today, or I'm one of the nurses looking after you today. Please, can you tell me your full name, your date of birth, while I double check with my paperwork and your wristband? And while the patient is saying to you, my name is Emily Grando, you are looking at your paperwork and you're looking at her wristband. And she says to you, my date of birth is 10th of 10th, 1970. And you verbalize, you scream aloud, hospital number 0004321. Assessor, I have the right patients. Please, you're wearing a red wristband. What are you allergic to? It's penicillin. Oh, bless you. Nobody will give you anything containing penicillin. But let me ask you, when you take penicillin, what happens to you? Oh, Nurse V, it gives me anaphylaxis. Nobody will give you anything containing penicillin. Seek consent. I am here this morning to administer your prescribed oxygen. Is this a convenient time? Yes, Nurse Violet. Please go ahead. I'll leave you with a call now while I assemble all my equipment. All right? Beautiful job. Keep the patient to the call, your second and your final hand hygiene for the station, okay? But before we do that second hand hygiene, I will read my prescription chart. Now, see what I'm going to do, guys. I'm going to read my prescription chart before I do my hand hygiene. This is a prescription chart for, I'm sharing it on the screen, Granga Emily, date of birth 10th of 10th 1970, hospital number 0004321, Ward Surgical Assessment Unit, date of admission today, height 1.60 meter, weight 60 kg, body surface area is 18, consultant is Dr. Wright, time of admission is 6 o'clock. This has been signed by Dr. Wright with the above details. Patient is allergic to penicillin and the reaction is anaphylaxis. I move over to the next chart, prescribed oxygen. Target saturation for my patient is 94 to 98%. Starting device and flow rate, reservoir mass 10 to 15 liters. Prescriber signature is Dr. P. Wright. Start date is today. Stop date is ongoing. Print name Dr. P. Wright. Pharmacy check has been done by Siju Thomas. Assessor, this prescription is due at my time and I'm happy to administer. I'll do my hand hygiene now. Palm to palm. Back of hands, fingers interlaced, fingers interlocked, rotation of the thumb, tips to the finger, and the wrist. My hands are clean. I will put on my apron and I'll put on my glove. Please, guys, I want you to take note. For all of your skis, you must wear your apron and glove. So put on your apron, put on your glove. Now, assessor, can you confirm that all my equipment has been cleaned and ready for use? Assessor says violet. That's correct. Continue with your patient. And on your tray, you see your reservoir marks on top of the tray. We don't need to take the reservoir marks and clean up the tray because the reservoir marks is just on the tray. Pick up your reservoir marks. Verbalize the expiry date. This is my reservoir marks. The expiry date is 5th of July 2028. It is valid, it is intact, and I'm happy to use. So now I am going back to my patient. So you go back. Mrs. Granga, I'm back. Are you still happy for us to continue? Please, would you mind reconfirming your name and date of birth for me? That's fine. All right. Emily Grando, date of birth 10th of 10th 1970. All right. Hospital number 0004321. Assessor, I've completed all the rights of medication, right drug, right route, doctor signature, blip number, all legible, and I'm happy to give. All right. So beautiful. So what I'm going to do now, I'm going to be connecting
to the
my
oxygen
reservoir
port.
marks to the oxygen. So connect your reservoir marks to the oxygen.
And you can see the
Put
calibration.
it on to 15 liters. For your OSCE exam, it is 15
Up to
liters
15
and not
liters.
10 liters.
So
So
turn
put
the
it up to
dial
15 liters. As soon as you put it up
up
to
to
15
15 liters.
cover the one-way valve
Or
with your
going
hands
up,
so that
you know
the valve,
the oxygen is working.
reservoir mass can be
Do
fully
it again, make sure it wants to be
inflated.
positioned.
Beautiful. Now we've done that. The next thing is, Mrs. Ailey, I'm going to be putting this over you now, okay? This oxygen I'm giving you is to help you breathe effectively. You could have some side effect like hyperventilation, skin irritation, but don't worry, I'll constantly assess your skin, your face, the back of your ears, okay? And I'll constantly give you mouth care, all right? All right, so put it over the patient. Ask the patient, are you comfortable? Are you comfortable? Yes, Nurse Violet, I'm very comfortable. If the patient says they are not comfortable, just adjust it so that they become comfortable. Are you comfortable now? Yes, Nurse Violet, I'm comfortable. Like I told you, I'll reassess your face, your ears, and make sure all of them are all right, okay? And I'm also going to give you mouth care. Is that okay? Beautiful. All right. So I would also check your oxygen saturation. Looking at our prescription chart, the target saturation for this patient is 94 to 98. So I'll make sure I reassess your oxygen saturation, okay? All right. Thank you very much, my darling. If you need any more questions, do not hesitate to contact me. Now, your charts. Look at our dates. Look at the chart. You write your date. You write your time. Flow rate is 15 liters / device is rebreathing max. So you put your 15 liters / rebreathing max. And if you look at this next chart I want to share with you, it shows administrator signature. Put your administrator signature because you administered it. So put your signature, put your print name. And that's it. This is the standard to pass your oxygen therapy in your OSCE exam. All right, guys, thank you so much. I don't want this video to be too long. I'm super excited. So far in the month of June, we've gotten over 40 passes from our online students. So if you want to be part of our online students, all you need to do is to email me at oldboyviolet83@gmail.com and we get along from there. If you have a receipt and you're not sure, do not hesitate to contact me. I will see you guys in another of my video. Until I see you again, keep passing your OSCE exam. Bye, guys.